What does your study show? Where do we stand right now? And what do we need to do?
Brian, I think you hit the nail on the head that the combination of screenings plummeted last year, especially in the April, May, June quarter. And so while everybody focused on COVID, we completely lost track of so much of the longer term issues, which was cancer detection. And also, frankly, with women bearing the brunt of so many of the challenges of the pandemic, whether it's homeschooling or themselves needing to put others first. What we've seen, and my own mother is a perfect example, who is a breast cancer survivor, who is also a caretaker, and she put off some needed surgery last year and ended up having to have emergency open heart surgery in the fall. So what we're seeing is, especially breast cancer screenings plunged dramatically, not only in the US, but around the world. They're coming back, but even if they're only back at a 90% level, that's way low. And particularly, as you know, and hopefully the person you're speaking to, if we catch cancers early, especially breast cancer, cervical cancer, if we catch them early, they are very treatable and we can get people back to their lives, and it's better for them. It's cheaper for the healthcare system. It's better emotionally. It's better all across the board. So we have to get people back to their screenings. And as part of certainly Breast Cancer Awareness Month is always a great time to highlight that message. And we appreciate you having us on for that exact reason.
Well, obviously, it's been a situation, Steve, that has been close to me and my family as well, and thank God your mom is doing well, and so is the person I know, and not taking anything away from COVID. 700,000 souls lost, more to come. It's terrible, but there are 600,000 people every year, who die of cancer, almost as many as COVID, who die every single year. Your company, if people don't know, makes a lot of the testing devices. You test for COVID. It's been sort of a boom time for testing. How has COVID and the sort of the rush that we've got to figure out better testing for everything, how might that help prevent some of those 600,000 deaths every year? Trying to find some kind of silver lining in this deadly
The silver
plague.
lining, you're asking the question that should be asked, Brian, and it's if we just take the same urgency that we have applied to COVID testing and apply it to especially all of cancer testing and particularly women's health testing. I personally have been tested for COVID 6 times in the last 5 days for various events, travel reasons. Right? We're able to put that urgency around COVID. By the way, I'm vaccinated and healthy and everything else, but we're not putting that same urgency or importance. It's almost like we're allowing the urgency of COVID to crowd out the importance of other diseases, cancer, frankly, emotional health, all kinds of other areas. So if we could just harness a little bit of that energy and urgency to realize that catching everything is important. And I think the diagnostics industry ultimately should be looked to as a savior here for so many things, where if we detect things early, we can treat them. We know exactly the course of action to take, as particularly in the case of breast cancer, but in all cancers. And so having that diagnosis early is exactly what we need. So we need to get people tested, not just for COVID, but for all their routine screenings, whether it's high blood pressure, sexually transmitted infections, anything.